I will explain my own protocol, but keep in mind it may not work for you. I am on my 8th year of Parkinson's. I still do not exceed 800 milligrams of levodopa per day. I attribute this to the lower dosage with all of my medications. I have severe dyskinesia and off times when taking only amantadine and levodopa. Due to my sensitivity, I take 1/4 and 1/2 pills frequently to avoid side effects. It is critical to have the correct timing for this method to work. When you feel an on or off mode coming on, you must know which drug to take. I always carry 2 days worth of pills in one bottle in order to keep track of my daily dose. I start with 1/4 tablet of levodopa, 25-250, and wait a half hour. If there is no effect, I take another 1/4, which will usually initiate dyskinesia. This is okay. It tells you where you are and which way to go. Remember, you are working around the levodopa first and foremost. 25-100 levodopa tend to send too much levodopa to the brain in my case. It causes severe dyskinesia. I try not to use them. As dyskinesia sets in, I allow it to reach the point of rigidity in my back and neck. I then take 50 milligrams of amantadine and a 1/2 milligram of piperidine. I also take 0.75 milligrams of Mirapex ER and add a 2 milligram rotigotine patch. Now I wait again for a half an hour to allow the medication to take effect. If the amantadine puts me in off mode, I add another 1/4 tablet of 25-250 levodopa. This usually does the trick. As dyskinesia begins, I add another 1/2 milligram piperidine, no amantadine. At this point, everything begins to do its job and allows functionality. It's also time to eat a very small portion of breakfast, regardless of what it is. This helps smooth out inconsistencies in the amantadine. You may feel an off mode coming after eating. Wait it out. It will pass. You've already taken 180 milligrams of levodopa. Avoid everything for another half hour and give the drugs time to work. For the next 3 to 4 hours, the extrapyramidal effects will be minimal. During this time, I literally nibble on tiny portions of levodopa when I sense an off episode. When dyskinesia begins to develop, it's time to add another 50 milligrams of amantadine and 1/2 milligram of piperidine. If dyskinesia persists, add another 1/2 milligram of an anticholinergic, not amantadine. Give it some time. After another half hour, if dyskinesia still persists, add 50 milligrams of amantadine and eat. Full meals of whatever you want are fine at this point. By this time, you will be under control to a degree, and it's usually early afternoon. You should be microdosing on levodopa at this time. You may also want to take 100 milligrams levodopa with a meal to prevent an off episode. If you have difficulty absorbing the levodopa, drink something acidic and carbonated. It hastens the response. Pepsi is probably the most effective. Green tea will work also, but dyskinesia can be a problem due to the ECGC content. If dyskinesia persists, follow the same procedure, but avoid amantadine for at least 4 hours before bed. You may end up acting out your dreams, experiencing slurred speech, and possibly euphoria. In regard to Mirapex and Nupro, keep them at 1 dose daily, no exceptions. With Maripex, do not take more than 0.75 milligrams. You don't need it. The Nupro is affecting D3 receptors, while the Maripex is affecting D3 and D4 receptors. Taking Maripex in 1.5 extended release or above can leave you waking up screaming in the night. The low dose of Nupro evens out the ratio of the agonists and reduces side effects. When it comes to ratios, the carbidopa-levodopa ratio is the most important. If dyskinesia is severe, you may be getting too much levodopa in the brain due to carbidopa. You may also be absorbing levodopa peripherally. If you are unsure of the reason for the dyskinesia, here's what to do. First, adjust the amantadine and anticholinergic up to 100 milligrams and 1 milligram respectively, while taking carbidopa-levodopa 25-100. If there is no change, it is more likely peripheral absorption. If it works, switch to 10-100 or 25-250 carbidopa-levodopa. Second, if increasing the antidyskinetic does not work, eat a high-protein meal, or better yet, a couple of chocolate candy bars or an avocado. They contain lecithin, which will in fact shut it down promptly. Third, reduce Maripex to 0.375 milligram tablets for 5 to 7 days. If it does not correct, eliminate the patch. This is an uncommon scenario. The patch tends to be more forgiving. If removing the patch works, increase the Maripex to 0.75 and leave it. Yes, this is complicated and requires some diligence, but it may provide some much-needed relief. Be certain to communicate with your doctor very openly and regularly so they can prescribe the right medications for you. This is not intended as a specific protocol or medical advice. This is simply what works in my case after studying and living with this illness for 8 years. The important takeaways from this are as follows. Number 1, keep a low dosage of your medications. More is not better. Number 2, pay very close attention to your condition and the effects of the medication. Keep a log if need be. Number 3, if it doesn't work, don't do it. There is no reason to take medications that do not help. Number 4, you are in charge of your condition. Parkinson's is different for every person. You must be persistent in finding the right treatment. Don't expect the doctor to hand it to you. Make sure your doctor is on your team and communicate with them. Think of it as Alice in Wonderland. It's either eat me or drink me. You'll never know if you don't try, but you must make a decision.